I have one question just to start, and I'm interested in the trajectory of the day. We sort of began in the morning with a very interesting discussion about is the media superficial, is it sensational, is it getting in the way of work that needs to be done by NGOs and by health responders, first responders, and I think all very important points. But I think some of what we're hearing this afternoon is about the role, the other perspective on that. Are the NGOs, are they in it for what purposes? Are they trying to raise money for their own organizations? Do they leave before the work is done? Do they use the media? And is the media complicit in driving that agenda or serving that agenda? And I know in our own work in Haiti that over the course of the months since the earthquake, there were increasing sense from the people on the ground that we were visiting, sort of the journalists that were going back, month after month, and there was increasing resentment against, all the SUVs around Port-au-Prince and the big meetings up in Pétionville and the aid workers who were doing very well, but where was the money coming down? Where was the effect on the street in Port-au-Prince or the rest of Haiti? And we've got this panel. This is a fascinating mix of ex-journalists turned NGO workers and looking at this from both perspectives, and I'd love to get your take on this. Is the news media less willing to hold? I mean, Leonard's just described something. He's working for International Organization of Migration, which gets a lot of money from USAID, government money, but he's trying to, from within, do something which I think is quite subversive. He's trying to set up a system. He calls it a feedback loop, but what it is an opportunity for people to call to account and call out the powers that be. Why aren't they producing the results with the billions of dollars that we put into it? So I'd just like to maybe open this up to everybody, and then we'll just let discussion go from there.
I'll take a first stab. I think the mother image cuts both ways, because on one hand, you'll find a lot of NGO materials that like to reduce it to one case study, one character, one person. In the Crisis Caravan, there's a new book out about the kind of unpleasant repercussions of humanitarian involvement, and Philip Gorovich, who has a kind of dicey relationship in Rwanda, which seems to be the counter-exemplar I get a lot. Paul Farmer and others, there is a blowback towards humanitarian involvement. You're seeing it in Sudan, you're seeing it in Rwanda, you're seeing it in Haiti, you're seeing it in a lot of places that we read sovereignty and kicking out NGOs as a bad thing, but in places like Haiti where, take cholera for example, an NGO can come and put your face on the front of a brochure or a pamphlet, reduce your story down to a kind of aid porn story, be very concerned about that allocation of one of the gaps is relief and development, or disaster preparedness and disaster response. And that's a considerable gap when you look at how little money gets allocated to preparing for the next disaster. And so my example about hurricane prevention, an unnamed UN official was telling me, this is the next tragedy waiting to happen, and there is no plan. What could you really do about an impending hurricane with 1 million IDPs? I'm not sure, but there wasn't as much money going into pre-positioning fresh water supplies as there was into working in areas that were directly impacted by the quake, fighting the last war, essentially. And so when you look at cholera, which may or may not have been, that footage was shot a mile or two downstream from the UN base where Nepalese peacekeepers may or may not have been responsible for introducing cholera. And that set off this wildfire protest in the capital. It wasn't just about cholera. People were telling me, this is also that the UN is tourists. Some people would say they're sex tourists. There's negative repercussions to that sort of involvement. And when you're a Haitian and you look at somebody who introduced cholera, didn't introduce cholera, somebody who used your face to make money but didn't exactly invest in some of the more pressing systemic crises, what's the difference? And that's the question that I have to ask myself. There's people doing things for the right reasons, perhaps, but I think what we don't really want, we're not comfortable with, and if you're going into this profession, I would think really carefully about the fact that burnout is a major problem, and bureaucracy is a really bad battle to fight, a real hard battle to fight. And there comes a point at which, in Karai, maybe you could speak about camp management pulling out. I talked to the camp manager there who is who said that burnout's a problem. We're sitting out here in the desert, and we want to be gone. And that's a reality that you have to factor into all the good intentions, is that the kind of unseen implications. So I think in Haiti, there are people trying to do good things, and there's people on the receiving end that don't see good things happening. And so the gap between good intentions or inputs and outcomes is a serious thing that needs some attention.
I want to just give a little bit of a counterweight to that very necessary but still slightly cynical view that, international NGOs are in it to make money. I mean, that wasn't quite what you said, but it does. We've had a hugely high profile in the Middle East at Human Rights Watch since January. And we may have gotten some increased donations because of it, but we've also had gigantically increased expenses trying to cover all of the different things going on in the Middle East today. And at Human Rights Watch, again, I can't speak for humanitarian organizations, which really are a different animal. When we send somebody to a country, it's like one or two people. We don't go in with these teams of dozens and dozens like a big humanitarian NGO. But we don't, the communications department is very decidedly not involved in PR. That's a separate function in the organization. The communications department is staffed with ex-journalists, like me, who, as one of them put it, wanted to get out of the bleachers and join the game. So I don't want to leave this audience completely cynical, although all the issues that you raise are certainly there.
Can I just say?
John, yeah.
I want to just, but that's, I don't mean to, I didn't ever mean to say that that's the reason but I think NGOs use the media as much as the media uses NGOs. That was the point. I also think, though, that I really do believe, after a long career in this, that solutions have to come locally, and people have to be invested in solutions locally. And that's, I have hope, because I think there are groups that are beginning, I think social media, the idea of people getting to have their own opportunities to communicate internally, I don't think solutions come from overseas. And I think that, including in the United States, solutions come from people in the United States. I think that, hopefully. And so I think that, I just think that my reason for optimism isn't really the international community. It's much more that I think at some point people realize that they have to do their own work, and they have to get these kind of loops in, and the Ukashidi, those kinds of loops that actually try to get some information and do their own. Because that development is an internal matter.
But would that be considered a radical view within Oxfam today, or not? That solutions have to come locally?
No, I think within Oxfam today, I can't speak of Oxfam today, I haven't been there for a while, but I would think that Oxfam, particularly Oxfam, has always placed a lot of emphasis on what local people think, say, and do, and our advocacy work comes from them. So I think that there are a lot of different kinds of NGOs, and some of them are definitely briefcase NGOs. They go in, they go out. Others stay there for a long period of time. Oxfam happens to be a development NGO which stays there longer. It's not just a humanitarian organization.
And Leonard, are you getting any, I'll come back to Enrique, but I just wanted to ask Leonard if you're getting any feedback from, pushback from whether it's IOM or from AID or other donors, international organizations who fear that you might be successful?
No, I mean, I think, genuinely everybody wants it to work, and, everybody wants the aid to get to the right place and pays a lot of lip service to consultation, and they have the consultation committees. If they get uncomfortable when you come a little bit close to their job, their bit, and start exposing things that are going wrong. And that's why it's going to be difficult, it's going to be lumpy. But I'm absolutely convinced that unless you have local people involved, you're wasting your time. I mean, the history of the world since World War II is littered with white elephants of development that don't work. And we're still happily building them. Very little thought goes into, very little analysis goes into why things haven't worked. I mean, there's so many. Bill just mentioned a place called Karai. I'll just speak briefly about that. Karai is a camp in the mountains underneath a mountain just outside Port-au-Prince. Last year, the U.S. military, for good reasons, encouraged people to move there and helped them move there and facilitated 7,000 people moving. The result has been what not to do, because with 7,000 people moved into camps, which are now structures, transitional shelters, 40,000 people were attracted in. So now you have a whole new slum which has grown up all around it. That's going to keep Carol's team busy soon, because it'll probably get bulldozed and there'll be human rights violations left and right. But quite often the humanitarians, for all the brain power and money they bring to it, get it horribly wrong. And this is a classic example of what not to do. And I think there's not enough self-analysis and self-reflection, and certainly not enough voices of the local people telling us where to do it, because this possibly could have been avoided.
Enrique?
I just wanted to add a dimension that hasn't really been touched on yet, and that's the role of the private sector and consultants and developers and so forth. And it kind of gets back to, at least in the planning sphere, we really need to pay attention to the way the systems, what systems were set up to dole out the money for what projects. And kind of building off of that, the fragmentation slide that I put up, those processes for doling out the money, for planning, and for kind of even conceptualizing what it is that will be planned and so forth, is itself fragmented. And so there's not an opportunity to look at the collective or even large-scale projects. And what's been created is this really, kind of small pots of monies and and an opportunity for a feeding frenzy for private developers primarily from the U.S., Florida, Georgia, and so forth. They're coming down saying, I can develop this for you. I'm bidding for the money. Now, I don't want to say that they're getting the money necessarily, but what has been happening over the last year is that dynamic, that process of reconstruction and kind of sorting out the money has been a huge, has created an energy drain, and it's really shifted the focus on what is it that we're supposed to be doing, or even could debate. Forget what we can, it really it's created such a diversion, and that's where the energy's going. But it's reinforcing that fragmentation that prevents this deeper analysis of what would it take to look after the community, the collective, the collectivity, the public good, if you want to get into that.
Well, and just one more. Whose failure is that? Is that a media failure not to report that, the gaps? Is it a government oversight failure?
No, I mean this goes back to, again, an analysis of how Haiti has been governed, and I'm
talking about how the international money is being spent as well, because you had a large infusion of money coming in from the international community, so you had the opportunity to have more transparency, more oversight.
And how has it? So whose responsibility is it to manage that?
That it hasn't been managed better.
That it hasn't been managed better. I mean, at least from if we want to kind of bring in the U.S. taxpayer part of it, we haven't been, we lost we took our eye off of that ball. No accountability. Where are the, how do you account for that money?
Leonard's people need to drop letters in the boxes.
I will say one thing, though, that the money has not been wasted. When you spend a couple of $1 million or whatever it is, buying new tarpaulins and restoring tarpaulins, you're keeping people safe. And I wouldn't be too quick to dismiss it. When the cholera crisis erupted, who cares who brought it there? Who cares, frankly? The bottom line is it's kind of decades of public health, lack of public health. And that goes back to governance. There are, fantastic canals all over Port-au-Prince which are full up to here with mud because of lack of kind of maintenance of the public health. It's a public health issue. So, for example, when the cholera came, first into the breach were the Americans. A huge amount of money, practically a conveyor belt of planes coming in with aquatabs and cholera beds and what have you. I don't think this is wasted money. The problem is, how do you get to the next level of having a safer, healthier society? And that's, unfortunately, where the conversation doesn't often go.
Questions, comments? Back in the back?
I'd like to think that, personally, that the days of the 3 a.m. infomercial, the pictures of children starving to death with flies, we're getting away from that. We're done with that. We don't need that anymore. That we can really focus on stories of empowerment. I think that the organizations that you all represent are really among those that are championing this new thing of really driving donors and activists to want to give and not feel like they have to give because of this kind of guilt model. But my question is, do you feel like programs perhaps like Citizen Haiti, or potentially taking what is really the PR vehicle out of the microfinance program, if not the donation models, could those systems apply to big INGOs, or perhaps even to the private sector in terms of maybe, yes, putting an individual face to a larger program, but then also taking the time to go back and to revisit that person, which could show potentially local engagement, sustainability, and maybe more accountability?
Is that a Leonard question? Citizen Haiti?
Yeah, why not? I mean, just when you mentioned going back to cases, this is a classic thing of journalism. People, the foreign correspondent comes in, they desperately get a fixer, they desperately find the human story, which they then sell to their editor, and they cling on to that human story in the face of all evidence. Doesn't matter what anybody tells them. They've convinced their editor, that's going in the paper, and any deviation, you're done. And then they have to go back a year later. And the funny story this year is my friend from the Times, who will remain nameless, the UK Times, they came back to get their person again. And this was somebody who was lost their legs, and was living way up in the mountains. And somebody in the UK decided to give them an education, a scholarship in some kind of Ivy League type school there. And they brought them, to the airport. Great kind of efforts went into it. Weeks and weeks of planning. And at the airport, I mean, the immigration officer said, "Well, what are you doing taking this 16-year-old out of the country? You're trafficking." So, media can get it around its neck as well, big time, just in the race for the story, and forget that there are so often rules and regulations as well.
There's that famous study that Nick Kristof cites about how people, when confronted with news that 200,000 people have died in Darfur, they turn the page. If you show them a picture of this little girl died in Darfur, then they give. And if you show them a picture of this little girl died in Darfur and 199,999 others like her, they also turn the page. It's only when you focus on that individual story, as I think you said, the only way to tell these stories is person by person, because otherwise the scale is too intimidating, mind-boggling.
That's something really absolutely true. So we produced this kind of book of the letter writers which we've had, and we then had, on the anniversary of the quake, we had a cocktail reception at the Montana Hotel, but not for ourselves, for these 10 letter writers. And a very interesting thing happened. We had the head of an unnamed UN agency was there, and she was introduced to one of these people here called Getty Ochelan. It's a formidable woman right here, and lives in Korai. And the head of the UN agency said, "Oh, fantastic, you've just got 3 new schools there. It must be wonderful in Korai." And Getty said, "No, madame, we've got 3 new schools but no teachers." So there was a kind of sharp intake of breath at the cocktail reception. And then ho, 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 well, surely they're coming. I know we're recruiting. "Yes, madame, I know you're recruiting, but that's in that sector. In my sector, we have no school, no teachers, cholera, gender-based violence, no protection, and by the way, can I have your contact details?" And that was interesting, because that was a kind of IDP, a refugee, the lowest form of life from the point of view of anybody with any resources in Haiti, actually engaging with the head of a UN agency as a community journalist, as a citizen journalist. So we hear a lot about citizen journalism, and there's a lot of guff talked about it, but I saw that happen, and my immediate boss, who'd come from Geneva, said it was worth the pain of being on the flight from Geneva just to witness that encounter, that civilized encounter of the two.
We're about out of time. Maybe a quick question or comment or two. One here, and then we'll wrap up.
I have a question for Enrique. I'm in public health, not in journalism.
So
And
you say you're a public health student?
yeah, not in journalism. And I think it's awesome that you're here, because it's a total different side of everything we've been hearing about. And I was like, I wish we had a planner, and I didn't read ahead that far. So my question is really, I see you having the biggest uphill battle, I think, out of everyone, being a planner in a country where everything is fragmented. So my question is really, how much progress are you seeing, and you see that there's going to be a lot of progress, and how much of it is a collaboration between you answering their questions, or the opposite? I mean, is it more you telling them what they need to do, or are they asking the right questions? I mean, where are you guys in the process?
I speak when asked to speak, and I went there because I was asked to go. I went because I was a former student of mine in Haitian who earned her master's in city planning. Was just about to graduate. She asked me to bring together a team of BU geographers and planners to look at the reconstruction of the area hit by the hurricanes, and it was through that teamwork that we were working on that right when the earthquake hit. Had met the Minister of the Interior, and he asked us to go in because he had met us on the hurricane topic. And so it's always been a response to a request on their part. where I see progress from the planning, city building perspective, and I hate the planning. We need a better term for what we do. It's a dead on arrival type of term. But what I think is fascinating that's going on, and this is just through observations of my colleague, this former student, and what she's doing down there, is that there are transformations in the types of relationships and debates that are going on day to day among Haitians over these issues of how to plan, regulate land, and so forth. They're not by any means kind of social contract type of conversations, but one, my student, it's a female, being asked by the mayor of Port-au-Prince to be his advisor to represent him and the municipality in negotiations where there's the World Bank, the Interim Reconstruction Committee, to represent the voice of the municipality and to be there constantly. And they admit that that's never happened before, and that strength of wanting to represent that voice on these issues about what they're going to do with the reconstruction of downtown Port-au-Prince is new. I find that very encouraging. It's very small in the bigger scope of things, but it's a shift. And at the same time, for every one of those examples, there are bigger examples of the forced, inertia, kind of, the old relationships that kind of helped build the city, do what, basically reproduction of what was going on, still going on. And the other thing I should say, I've worked only almost basically with Haitians, so I've had very little contact with the UN, the international community, and so forth. So my lens has really been with seeing the Haitians fight it out among themselves. And so I'll be the first one to admit that I'm not seeing even the whole panorama, but the way I was trained, and I think that's important because going back to the local, it's their land, it's what they're going to have, it's their fight to fight.
Yes, but can they pay for it?
No. And that's where Haiti is such an interest that if we look at it as hyper fragmentation and then and we look at the complicity behind who is involved in what Haiti is today, the budget question, the money question can't be. It's not just it's unfair. It's unrealistic to say the Haitians are going to come up with their own money because there's got to be some kind of system that shifts that dynamic over. It's not them. I mean, it's us too. It's a question for us. The U.S. us, the world, international, so forth. But
I think the tambour drums are waiting for us outside and drinks, and I hope we can continue this conversation over drinks. I want to thank the panel for this really extraordinary range of perspectives.